First is, as more of our population and staff are being vaccinated, and we begin moving towards reopening programs, offices, and facilities, how are we going to handle those clients and staff who have not been vaccinated? Will they continue participating virtually, or will there be guidance in the future?
Well, from a clinical standpoint, for me, it depends on whether or not we've achieved herd immunity around this. And we won't know that until we have enough people vaccinated and there's enough studies done on it. But I don't know how you guys will handle that from a program standpoint. Because as of now, nobody's making it mandatory to be vaccinated.
I think from a programmatic standpoint, we would continue to assess the situation, getting feedback from both internal and CDC sources about best approaches, and would have to say we would take it as we move forward. So we certainly would be as cautious as possible and follow all recommendations from our experts.
Does anyone else want to add to that? Okay, I'll move on to the next question. And this is probably something for Sheena. Are shared services employees able to get the vaccine at FPCN? What about our families if they are in high-risk categories?
Oh, for the first part of the question, yes. Shared services employees are still within those 1A, 1B categories. Are shared services employees that are front-facing, coming into the office every day, or at high risk, are on the same level as all of our employees that we tried to get to the front of the line to get the vaccine. But as we open it up to all staff, of course, shared services employees are in that category as well. And if you have not received information to register, please reach out to me so I can get that to you. As it pertains to employees, high-risk employees, I'm sorry. As it pertains to high-risk employees, they should still utilize, registration links available throughout the cities or locations where they live. For FPCNs, our vaccination clinics, right now it is only open to RHD staff and consumers. When the next phase of that opens up to the public, we will let everyone know. So your family members or whomever will have the opportunity to register. But right now it is just for RHD staff and consumers.
Thanks, Sheena. I don't have any more questions at this time.
Can I just make a few statements about maybe clear up a couple of misconceptions about the vaccine? Do you have time for that? So one of the misconceptions is that there's a waiting period, 90-day waiting period, which has been cleared up if you go onto the CDC website. You only have to wait 90 days to get the vaccine if you have received monoclonal antibodies or convalescent plasma. And this is usually a treatment given to someone who has had COVID and has been hospitalized in the intensive care unit. So this does not apply to most of the population who have received the vaccine. If you had COVID-19 and recovered, or currently have COVID-19 and have symptoms, you would just wait until you're out of your isolation period and asymptomatic, but there is no delay period for receiving the vaccination. There's also been a question of the vaccine causing Bell's palsy. I've heard this one going around on Instagram and Facebook. You're more likely to get Bell's palsy, which is like partial facial paralysis from an everyday virus, including anyone who has history of cold sores. If you just get a regular cold virus, you are increased risk for developing Bell's palsy. There have been reports that handful of people who received the vaccine develop Bell's palsy. And the research suggests that they don't think there's a link between the two. So again, you're more likely to get it every day, just getting any other type of virus, than from getting it from the COVID-19 vaccine. It is a temporary condition, usually lasting a few to several months, and then it resolves. Rarely does it ever become a chronic thing. And usually in that case, there's a family history of Bell's palsy. So those are the two things I just wanted to throw out there.
There's a question in the chat too, that while you're chatting with us, maybe you could answer. Is there information on how best to inform and encourage folks who are resisting the idea of vaccination? I know many who are resisting.
I think the more that people become vaccinated that look like them, who live in their circles and that they see are okay from the vaccine, then they'll be more willing to get the vaccine. Some people, no matter what you do, if you offer them $1,000, they're not going to get the vaccine for whatever reason. So I think, so for me personally, I was very hesitant about getting a vaccine. I don't know if I shared that with you guys before, but with doing the research, I ended up getting a vaccine, and then my family soon followed suit. A lot of my colleagues in the clinic who were hesitant, who are people of color, followed suit. And then more of those people who got it and saw that everybody was okay. And then with the second dose, I got my second dose on Friday. That made more people less hesitant. So I think the more people get it that live around other people who are hesitant and they see that, no, I didn't get Bell's palsy. No, my arm didn't fall off. I didn't grow a third eye. Whatever, people are saying is going to happen with the vaccine, the more people see that those things are not true, the more comfortable and confident they will be about receiving the vaccination.
Great, thank you. I'm just going to ask you one more question. Are there any other rumors that are out there that you can address, since that seems to be the kind of the latest thing happening?
So the only other thing is I've heard people say, well, I had COVID-19. I have natural immunity. I don't need to get the vaccine. Yeah, so getting COVID-19 does offer some natural protection, but we don't know how long that protection lasts. And we know that people can get it again, and that puts you at risk for, severe illness and even death. And as far as the vaccine, as long the studies are continuing to go on, they're starting to see that the vaccines are offering longer protection against the virus than previously thought. They're still not saying how long, but they don't think that we're going to require a booster shot as of yet. There's no evidence that we require a booster shot after the 2 doses.
So there's a little more in the chat. I'm imagining there's not much information about long-term effects yet, but that seems to be a concern. Is there anything you can speak to on that topic?
Yeah. So once you receive a vaccination, typically the vaccine only stays in your system for a few weeks until your body develops the antibodies. And then once that's over, the vaccine is done. You're just left with antibodies that are part of your own natural immunity. So we know that there are some long-term effects from the coronavirus and I think I spoke to this before, with people having chronic pain syndromes that they're developing from having been infected with coronavirus, long-term lung issues, cardiac issues people have as a result. And these are young people who were relatively healthy before coming out, from this disease with long-term sequela. So there's not a lot about long-term effects of the vaccine. Vaccines are relatively safe, but you have to weigh the good with the bad. Like, do you want to take the risk of having long-term sequela from actual disease or from a vaccine, which likelihood of having long-term sequela is almost 0 to none.
Okay, so the questions keep coming. How did you feel from the second dose? Did you have Moderna or Pfizer? And
So
yeah, and the flu, did you have the flu symptoms that people are talking about?
I must have been one of the lucky ones because I had no symptoms other than, like I said before, my arm was sore. Now, the second time around, there was a little bit of a delay on my arm being sore. I didn't actually feel it until like Saturday. It just felt like all of a sudden somebody punched me in the arm. But today I'm fine. I don't have any symptoms. I feel as best as I've ever felt. So I'm really happy that, I didn't let my initial hesitation stop me from getting the vaccine.
All right, one more, sorry. Allergic reactions, conspiracy theories. Can you speak to either of those?
So what kind of allergic reactions? Or can you be more specific? Usually allergic reactions that happen from anything in the environment that's external to your body happens immediately within like the first 15 minutes. So that's why we observe people for 15 minutes to a half hour. Because if anything's going to happen that's like an anaphylactic type reaction, it usually happens almost immediately. I know I've seen some stories about Hank Aaron. He received his COVID vaccine, and then 2 weeks later, he passed away. The man was 86 years old. They're saying that he died of natural causes. He passed away in his sleep. So they're not associating his death at all with the coronavirus vaccine.
Thank you. Let me pass it to Sarah now. Thank you so much. And of course, please stay on.
Okay, I have a couple more questions about the vaccine. Sheena, I know you already spoke about this, but I think it might be helpful to reiterate since folks seem to have a lot of questions about getting the vaccine at FPCN. Can any staff go to FPCN and register to get the vaccine? And if someone does make an appointment to go, do they need to have proof that they are in group 1A or 1B?
Okay, so at this time, on registration, you need to register before you go. So if you did not receive a link, reach out to me so I could give you the links to register for that. I think that answered the first question. The second question, do you have to show proof that you do not have to show proof when you, Nina, correct me if I'm wrong, you don't have to show proof that you're in a specific phase when you go in after you register and go to get the vaccine. So let me be clear about this. Initially, we make every effort to get the vaccine registration out there to our most vulnerable populations in the 1A, 1B category. So these are our frontline staff, these are our consumers, these are people in the highest risk categories. We have a window in time in which we have to get our registration information over to FPCN so they can register everyone in their EHR system. So if our registration does not fill up in a certain amount of time, we then made the decision, like this morning, to open it up to all staff to be able to register. And that's so no doses are being wasted. The last thing we want to do is waste any doses of the vaccine because these are extremely valuable and limited. So I want to make that kind of clear. So at this point in time, we opened up the 3 sessions. There's one on Wednesday morning, one on Wednesday afternoon. I believe the Saturday session is full to all staff at this point who are able to come to the area to get the vaccine. So I hope that answers your questions.
Thank you. Someone else said that they are getting the vaccine tomorrow. Do they have to submit results to anyone? Or I guess I'm assuming they mean their vaccination card.
Yeah, I'm assuming that they're not getting it through FPCN because our sessions are Wednesday. But
They're not.
So we're not requiring anyone to submit their proof of vaccinations at this point. I don't believe, but please correct me if I'm wrong, someone. I don't believe any regions, funders, local governments are requiring that as well. It's completely optional. If you want to come into your supervisor and, let them know that you had the vaccine, add it to my file, add it to my chart, you can absolutely do that, but it's not required.
I can keep going. Does anyone else have anything they want to add to that?
I would just share with the community that, in terms of tracking or identifying who has and who hasn't received the vaccine, our consumers as well as employees, as what has been shared thus far, is in terms of there's no requirement, but we're also understanding and seeing that eventually that might be something that we may want to do, need to do, be required to do. So right now we are remaining flexible as the larger country remains flexible in terms of what's required and what is not. We recognize that, there is some writing on the wall that eventually we may need to identify within our populations who has and who hasn't. I think for our consumers and the folks that we support, we're already maintaining much of their information within our electronic health record. Adding whether or not they've received the vaccine might be a logical next step, but there's also an approach that we want to consider that Sheena and team are evaluating as well as we move forward. So know that we hear the question, and it is something that is being actively discussed, not just within RHD, but in the larger community as to what should or shouldn't be done as everything continues to evolve. Thank you.
Thanks, Marco. Sherry, I can keep going.
Sure.
Okay. Someone asked, is it okay to receive the second dose of the vaccine earlier or later than the window of 28 days? And this person is someone who got their first dose through an organization that is no longer providing second doses. And their second dose is 25 days. So they're asking about that window. I don't know if.
So it depends on, okay, so what vaccine was it? Because that's going to determine.
They
where
were not
need to
clear.
go.
They were not clear in their question which vaccine it was.
Okay, so the
Moderna. Sorry, they just told me Moderna. It's
okay, so if it's the Moderna vaccine, we're looking into ways to accommodate those people here at FPCN. You shouldn't get it any earlier. It needs to be 28 days. But the research suggested it can be given as late as 45 days after the vaccine and still be effective. So.
Thank you.
While you're there, hold on, Sarah, there's another question sort of similar. So in Delaware, we're having an issue getting the second dose. Can we come to Philly to get it at FPCN? Sorry, Sarah, I just figured kind of similar.
Yeah, you're right. Thank you.
I would say if you fall into those categories, yeah, why not? You just have to make sure you bring your vaccine card with you as proof that you received the first dose.
Doesn't matter which they got, Moderna.
So it has to be the Moderna vaccine because we only have Moderna. The vaccines are not interchangeable. So if you had the Pfizer vaccine, you have to find somewhere to get the Pfizer vaccine.
If this applies to you, could you please reach out to me directly? Don't register with the registration. If this applies to you, please reach out to me directly.
Thank you, Sheena.
Thanks, folks. Someone else in the chat asked, said, so once you have the vaccine, you never have to have it again?
So far, that's what they're saying. They don't think there's a booster dose, but more research has to be done because this is a new vaccine. So we have to wait and see where the chips fall. But as of now, they don't think so.
Okay, Sherry, that is all I have on my end.
All right. And that takes us through all the ones in the chat too, correct, Sarah? Or you're going to repeat?
One person specifically asked, Nina, if she had the Pfizer or the Moderna?
It's the Moderna, the one that we offer here. I got the one that we give. Our trusty MAs gave me the vaccine here at our site. I trust them. You should too.